One of Disability Rights Wisconsin's PAMI priorities is to work to eliminate abuse and neglect and address patients' rights violations for PAMI eligible individuals in all mental health settings. We primarily address these goals when in an individual advocacy sense by investigating complaints and advising individuals about their options and their rights to file a grievance or a complaint. Our systems work involves reviewing resident death reports, regulatory licensing violation notices, and findings of immediate jeopardy, and meetings with state and county administrators and other leaders to help discuss, to discuss concerns or issues. When DRW receives a complaint that a PAMI eligible individual has been abused, neglected, or that their rights were violated, an advocate will typically speak with the person or their legal guardian and advise the person about available options to resolve the situation or to file a complaint or a grievance. While DRW has insufficient capacity to act in a primary protective service role, we connect PAMI eligible individuals to those systems and assist when facility or county staff or state regulatory entities fail to respond promptly or adequately. DRW is more likely to provide individual case advocacy if the allegation involves serious abuse or neglect likely to cause substantial injury. For example, if DRW receives a complaint that a PAMI eligible individual has been physically restrained in a residential setting resulting in injury, an advocacy specialist would likely speak with the person and their guardian, advise those people how to file a complaint or a grievance within the licensing, certifying, funding, or placement agency. The advocacy specialist may review service plans, behavior support plans, or other records and speak with facility staff or supervisors about recommended changes to keep the individual safe and to protect the individual from ongoing abuse, neglect, or rights violations. If the person is enrolled in a community-based mental health program, such as the Community Support Program, CSP, or Comprehensive Community Services, CCS, or if the person has a co-occurring physical disability or developmental disability and is enrolled in family care, we would most likely work to connect that individual to their case manager, to an ombudsman, or to a supervisor to request changes to the service plan, to the restrictive measures plan, or to the residential placement itself. Of note, DRW does not represent people in legal actions seeking damages, such as in a personal injury, medical malpractice, or wrongful death lawsuit. Questions about those types of actions would be referred to private attorneys. Now, moving on from our individual advocacy to a systems advocacy or our systems approach. When any resident dies at one of Wisconsin's state-operated facilities, including Winnebago Mental Health Institute, Mendota Mental Health Institute, Sandridge Secure Treatment Center, or the Wisconsin Resource Center, which are the facilities identified as most likely to have residents who are PAMI eligible. Disability Rights Wisconsin receives a copy of both the preliminary and the final death reports. Those are reports completed by facility staff and sent to the Department of Health Services Division of Care and Treatment Services, or DCTS. DRW also receives notification when an individual dies at the Milwaukee Mental Health Complex or within 30 days of discharge from the Milwaukee Mental Health Complex. Our medical records analyst reviews all of these death reports. If anything in the report raises suspicion of potential abuse, neglect, including medical neglect, or serious rights violation, DRW's investigations team will open an investigation. An investigation typically involves reviewing additional records, such as medical records, coroner's reports, facility and state policies related to the situation, and internal investigations. If appropriate, the investigations team will release a report, request changes to facility or state policies, or meet with facility or county staff or state administrators to discuss concerns or conditions that may result in abuse or neglect of PAMI eligible individuals into the future. The Division of Quality Assurance, or DQA, is Wisconsin's state survey agency. In that role, DQA investigates complaints and completes ongoing certification surveys for multiple state and federally regulated facilities, including nursing homes, assisted living facilities, adult family homes, and hospitals. Another thing that DRW does on behalf of PAIMI eligible individuals is review the action that the Division of Quality Assurance, or DQA, takes. When deficient practices are found, DQA issues a statement of deficiency, or SOD. DRW receives notice when DQA issues an SOD with a significant enforcement action, such as a finding of immediate jeopardy to resident health and safety, an order not to admit new residents, a proposed license revocation, or proposed termination of Medicare and Medicaid participation. We review these notices and, when appropriate, reach out to ensure sufficient action has been taken to protect PAIMI eligible individuals from ongoing abuse, neglect, or rights violations. For example, a finding of immediate jeopardy was issued against Milwaukee County Mental Health Complex. DRW was involved in multiple meetings with facility leadership to discuss that finding and the response. In addition to the statements of deficiency that come with significant enforcement action, DRW also monitors publicly available statements of deficiency that have less significant or even no enforcement action. Even though DQA has identified these statements of deficiency as not needing significant enforcement action, sometimes we do discover that one describes abuse, neglect, or serious rights violations of a PAIMI eligible individual. And when we find that, we engage in additional investigation or perhaps outreach to ensure that sufficient action has been taken to protect the individuals from future abuse or neglect. Again, if appropriate, the investigations team might release a report or request changes to facility or state policies, or meet with facility or county staff or state administrators regarding any concerns or conditions that may result in abuse or neglect of PAIMI eligible individuals. We also have ongoing quarterly meetings with Division of Quality Assurance, DQA leadership staff to discuss emerging issues and concerns for individuals with serious mental illness in regulated facilities. So those are both immediate concerns that might be brought up by us or by DQA leadership, or ongoing concerns that we see in our monitoring activities. Thank you.